What is ARIKAYCE? ARIKAYCE is used in combination with multidrug therapy for adults who still test positive for MAC lung disease after at least 6 months on multidrug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age.
Mycobacterium avium complex, or MAC, is the most common form of non-tuberculous mycobacteria. You may be put on the guideline-recommended multidrug therapy, which means that you will take more than one medication at the same time. Patients with MAC lung disease are treated with more than one antibiotic because, unfortunately, there isn't one single antibiotic that can effectively kill the bacteria. These medications work together to attack the NTM bacteria in different ways. Using more than one treatment also helps prevent the bacteria from becoming resistant to one antibiotic. Unfortunately, standard combination therapy alone may not work for every case. ARIKAYCE was studied in and approved by the FDA for MAC lung disease patients who did not respond to combination antibiotic therapy alone. ARIKAYCE is added to combination therapy and is not taken alone. The FDA approved ARIKAYCE under a limited population pathway, which is for a limited and specific patient population. ARIKAYCE is an inhaled antibiotic that you take using a nebulizer. It's different from other inhaled antibiotics because the amikacin is contained inside tiny particles called liposomes. These liposomes are designed to help the medication reach the MAC bacteria in the lungs. For standard MAC treatment based on guidelines, I typically plan to maintain patients on treatment for 12 months of negative sputums beyond initial culture conversion. I also apply this to ARIKAYCE treatment. In the clinical trial, the protocol called for 12 months of treatment after the first month of culture conversion.
When patients first begin ARIKAYCE, I usually spend time talking with them about how the device works, specifically the nebulizer from which they will inhale the drug. We also discuss the adverse effects that may or may not occur with the drug and when to notify their physician, and we also discuss how to follow up as far as routine clinical monitoring and setting expectations about appointments. Everyone responds differently to treatment. If you have questions about the possible side effects associated with ARIKAYCE, be sure to speak with your doctor. ARIKAYCE is associated with a risk of increased respiratory adverse reactions, including allergic inflammation of the lungs, coughing up blood, severe breathing problems, and even worsening of COPD. While using ARIKAYCE, side effects may become serious enough such that treatment in the hospital is required. Call your healthcare provider right away or obtain medical help if you are experiencing any serious side effects while taking ARIKAYCE. So I explained to the patient the goals of therapy and the length of therapy, which is 12 months of negative sputum cultures. When you're on treatment for MAC lung disease, it's important to check sputum cultures frequently to see if MAC continues to grow in the culture. That involves coughing up a sputum sample and often either taking it or mailing it to your doctor's office. While patients are taking ARIKAYCE, follow-up appointments are necessary with providers. At those appointments, we usually check sputum cultures to understand if MAC is still growing in the sputum. We also talk about the treatment response to ARIKAYCE and any possible adverse effects the patient may or may not be experiencing. In addition, radiographs may or may not be necessary, as well as other testing as defined by the doctor.
I usually see a patient within the first month after starting a new therapy, and then every 3 months thereafter. 3 months is a good time point to monitor these patients because I'm also doing routine audiograms while on treatment.
Recently in clinic, I saw a 67-year-old white female. I placed her on a standard oral multidrug regimen, and she tolerated the regimen quite well. We checked sputums monthly, and despite the use of a correct regimen, she still remained culture positive for MAC at 6 months. I placed her on daily ARIKAYCE according to the package insert. She was very pleased with her progress, and of course, so was I.
You can learn about how many people in the ARIKAYCE clinical study achieved culture conversion, the side effects they experienced, the sample size, types of patients enrolled, and how many patients successfully completed the study. You can learn more about this on ARIKAYCE.com.
Important safety information and boxed warning. ARIKAYCE can cause serious side effects, including allergic inflammation of the lungs. These respiratory problems may be symptoms of allergic inflammation of the lungs and often come with fever, wheezing, coughing, shortness of breath, and fast breathing. Coughing up of blood, hemoptysis. Coughing up blood is a serious and common side effect of ARIKAYCE. Severe breathing problems. Severe breathing problems can be symptoms of bronchospasm. Bronchospasm is a serious and common side effect of ARIKAYCE. Bronchospasm symptoms include shortness of breath, difficult or labored breathing, wheezing, and coughing or chest tightness. Worsening of chronic obstructive pulmonary disease, COPD. This is a serious and common side effect of ARIKAYCE. Serious allergic reactions. Serious allergic reactions that may lead to death have happened to people who take ARIKAYCE. Stop taking ARIKAYCE right away and get emergency medical help if you have any of the following symptoms of a serious allergic reaction: hives, itching, redness or blushing of the skin, flushing, swollen lips, tongue or throat, trouble breathing or wheezing, shortness of breath, noisy, high-pitched breathing, stridor, cough, nausea, vomiting, diarrhea, feel cramps in your stomach area, fast heart rate, feeling lightheaded, feeling faint, loss of control of the bowels or bladder, incontinence, and dizziness. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed. Call your healthcare provider or get medical help right away if you have any of these serious side effects while taking ARIKAYCE. Your healthcare provider may ask you to stop using ARIKAYCE for a short period of time or completely stop using ARIKAYCE. Do not use ARIKAYCE if you are allergic to any aminoglycoside or any of the ingredients in ARIKAYCE. Before using ARIKAYCE, tell your healthcare provider about all medical conditions, including if you have asthma, COPD, shortness of breath or wheezing, bronchospasm, have been told you have poor lung function, have hearing problems such as ringing in your ears or hearing loss, have dizziness or a sense of the room spinning, have kidney problems, have neuromuscular disease such as myasthenia gravis, are pregnant or plan to become pregnant. It is not known if ARIKAYCE can harm your unborn baby. ARIKAYCE is in a class of medicines that may be connected with complete deafness in babies at birth. The deafness affects both ears and cannot be changed. Are breastfeeding or plan to breastfeed. It is not known if the medicine in ARIKAYCE passes into your breast milk and if it can harm your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with ARIKAYCE. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. ARIKAYCE may cause serious side effects, including hearing loss or ringing in the ears, ototoxicity. Ototoxicity is a serious and common side effect of ARIKAYCE. Tell your healthcare provider right away if you have hearing loss or you hear noises in your ears, such as ringing or hissing. Tell your healthcare provider if you start having problems with balance or dizziness, vertigo. Worsening kidney problems, nephrotoxicity. ARIKAYCE is in a class of medicines which may cause worsening kidney problems. Your healthcare provider may do a blood test to check how well your kidneys are working during your treatment with ARIKAYCE. Worsening muscle weakness, neuromuscular blockade. ARIKAYCE is in a class of medicines which can cause muscle weakness to get worse in people who already have problems with muscle weakness, myasthenia gravis. The most common side effects of ARIKAYCE include changes in voice and hoarseness, dysphonia, cough during or after a dose of ARIKAYCE, especially in the first month after starting treatment, muscle pain, sore throat, tiredness, fatigue, diarrhea, nausea, headache, fever, decreased weight, vomiting, rash, increased sputum, or chest discomfort. These are not all of the possible side effects of ARIKAYCE. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including boxed warning, at ARIKAYCE.com.